And coming up next, we got Merle Norman Cosmetics talking about some holiday looks. But first, here's a word from our friends at American Senior Communities. Take a look. Wow, that looks so good, man.
The following portion of video now is sponsored by American Senior Communities.
Welcome to Chad Miller from ASC and Dr. Kevin McNulty, a Geriatrician and Program Director from Ascension St. Vincent, to teach us about delirium, how it's treated, and what you can do if you think a loved one may be experiencing it. Guys, thanks for being here today.
Guys.
We appreciate it.
We're glad to be here.
Yes, this is an important topic because you're going to be helping a lot of families, educating them about this. So let's go over, first of all, what delirium even is. How do you describe it?
Sure. So it's an acute change in one's mental status that most commonly will occur in the hospital. However, it can occur in the community as well. Our brain is an organ. We don't really think about it that way, but it can get inflamed and have damage done to it acutely when we're sick.
Okay.
Older adults by far are the most prone to it to occur, but it can even occur in children if they're sick enough. Most commonly will occur in the ICU or after surgery.
All right.
And what it is an acute change in one's mental status. It tends to fluctuate, and people classically will have sort of a fluctuating awareness and fractured attention span, their ability to focus.
Wow. Chad, talk to us about what ASC is doing with your Wellness Wisdom program and how you're educating Hoosiers in the community.
Yeah, absolutely. So American Senior Communities is the largest senior living provider in Indiana. With the Wellness Wisdom campaign, we really wanted to be able to bring top physicians to be able to educate all of our seniors throughout the state of Indiana.
Yeah. And that education is so important.
Absolutely.
It's helping a lot of people. I know you were talking about some of the symptoms and things. What are some other symptoms that we should really look for and recognize in our loved ones?
So the individual who struggles to wake up is one of the more classic examples, or sleep dysregulation. They're up all night and asleep all day is very common with it. Visual hallucinations are not uncommon. Auditory is more unlikely to happen.
Okay.
Some individuals will talk a lot more. Most individuals talk less, or they make less sense.
Okay.
And they're often afraid.
Often afraid. This can be, I imagine, very troubling for a loved one, maybe a caregiver who's experiencing this, and they may not know what to do. So what are some of those best steps that you would recommend if someone is wondering, maybe mom or dad or great aunt, whomever might have this? What would you recommend?
So it's a very scary experience to see our loved ones going through this. It's also scary for the individual who's experienced it. Most of them won't remember it. However, those who do usually tell me that they were very afraid during it. So the first thing is to make their medical team aware that this is not their normal baseline. Sometimes this is thought to be dementia, and it is not. It's very different. So making sure that the care team is aware, because usually it's multifactorial for why it's happening. And our job as the medical professionals is to recognize it, try to identify everything driving it, and correct what we can.
Yes.
Well, and because of, the complications with something like this, you were explaining to us, even when we were sitting down, that it can be underreported because people may not be familiar and they don't really know what it is they're seeing.
Yeah, it oftentimes goes unrecognized by us as healthcare workers, as well as by even families. And it goes undocumented oftentimes too. So primary care is often unaware that someone experienced it. And if you have severe delirium, it can lead to cognitive changes. Even children have been shown to perform worse academically afterwards. But we can help them recover.
That's great. And Chad, if someone's watching right now, maybe they've experienced this within their own family, or they might be seeing some of those signs that Dr. McNulty was talking about, what do you want them to do, and how can they get in touch with the team at ASC?
Yeah, so they can go on asccare.com and we'll have information on there regarding this segment on delirium and other educational topics too that we'll be presenting on.
That's great. Well, thank you for offering that.
Yes, it's so nice you're offering that. And if people want more information about all of your programs and everything you're doing, what's the best way?
Yeah, so asccare.com is the best way, obviously, to get this information out. We'll also be looking at in the future probably doing some podcasts as well, just to be able to educate more seniors throughout the state, just on a lot of different educational topics that are affecting them and their loved ones.
Yeah, being informed is so powerful, and in this case might even help a loved one who might be experiencing this. Dr. McNulty and Chad, thank you so much for your time today. We appreciate it.
We appreciate it.
Yeah, you bet it.
Thank you. The following portion, the preceding portion of Indy Now you just watched, sponsored by American Senior Communities.
Stick around for more Indy Now coming up right after this, friends. Good job, gents.
Thank you.
Well done. Thank you.